Okay, so this is just a little tutorial that's going to go over the APG examination tab. That's essentially kind of like a scribing the objective portion section that medical assistant should be using when scribing for the DPM. So in this example, we're going to use a test patient, which is test 9 patient, and this is going to be a plantar fasciitis example. If we look under chief complaint, I've already put this in over here under the multiple complaint form. And you can see this patient's got a chief complaint of pain of the plantar heel, pretty typical stuff over here. And what's going to happen now at this point in time, the medical assistant will have got this information from the chief complaint form that was filled out incognito or handwritten by the patient upon arrival. So now in the room, the medical assistant will come in with the doctor. The doctor will start their examination. And this is going to be done under the physical examination tab under APG exam. As opposed to doing APG exam, we're going to be doing APG examination. Okay, and this will be a little bit less cumbersome than the APG exam tab that we've previously used. So APG examination. So in most cases, our patients are going to be alert and oriented. And then we're going to go through our cardiovascular system and the dorsalis pedis on the top part of the foot, PT pulse on the medial side of the ankle, and capillary fill time, and so on and so forth going down here. So on examination, the DPM will call out for cardiovascular the relevant findings. Not everything may be gone over, but let's just say, in this case, we say DP and PT pulses are 2/4 bilaterally. So you would just go 2/4. That means they're pretty much well felt, whereas 1/4 means they're barely felt. 0/4 means they're not felt at all. Okay. Capillary refill time is going to be either instantaneous, 1, 2, 3, or above. Most healthy people will have a 1 second or instantaneous. Hair growth, we're talking about where they have hair present on their toes, but there's just a little bit or there's none on the toes. And we can even have the option of saying it's present to the foot, present to the toes also too, or it's completely absent. In this case, we can say present to the toes. Let's say if patients have it present to the toes, don't have it to the toes, but we see it on the foot. Anyway, that's how that gets put in here. Edema, either there's no significant edema that's there. Non-pitting means there's edema that doesn't leave indentations. 1+ and 2+ is the severity of the edema. Also, if it's pitting, where you kind of apply pressure to the foot and it leaves an indentation even after you release the pressure. If the patient may have an injury, they may also have edema that is localized to an injury site over here too. Okay. So let's just say in this case, there's no edema on either side. Again, this patient has right heel pain. Varicosities, we'll just say none. And we'll say skin temperature is warm in most people. Hot may be in case of infection. Cool is just a little cool. Cold is like potentially circulation problems. Dependent rumor means when the feet are down, do they look red? And that's an abnormal finding. Usually poor circulation, there's other things that will go along with it. Advanced trophic changes relates to RFC type findings, and usually there's some of those. If this is an RFC patient, we will kind of go over which one of these are present here. And again, if we're not mentioning it, then it can be left blank. Neurological, do they have feeling? If we just kind of brush our fingers, can you feel this? We'll go into more detail if they're diabetic. And one that's specific for diabetes, we'll do the Semmes-Weinstein monofilament test, where we have a little plastic wire and we'll apply it to different places on the patient's foot. If everything is normal, then we just say intact to all sites. You can see what it says, deficits are noticed. So let's say if there was, patient didn't feel it on the 5th toe and on the first met and the 5th met head, we would click that and click that. Okay, so in other words, deficits are noted. But let's say in the case of this patient, it's normal. If we go down, sharp dull sensation is telling whether something is sharp or dull. There's ways we can test that. Vibration is when we are applying the tuning fork and telling patients to let us know when they stop feeling the vibration and it's just pressure. We'll hit the tuning fork against ourselves, put them on the tip of the toe, the first MPJ, and have the vibration kind of wane. And at one point the patient say, okay, just pressure now, or there, they'll say, and ideally the patient should stop feeling the vibration just before the doctor stops feeling it in their hand. But let's say in this case, this is a healthy patient with just heel pain, it's intact. Proprioception is where you're moving the big toe up and down, saying, can you tell me as soon as you feel the toe going up or down with your eyes closed, and we move it slowly, and the patient will just say up or down, and they should be able to respond relatively quickly to that. That's the proprioception. Deep tendon reflexes, we'll usually do like an Achilles tendon reflex if we do anything, and +2 is the normal finding for that. Chinell sign is something we test for tarsal tunnel, where we touch on the inside part of the ankle and ask and look to see if there's any zinging sensations that go into the foot or up the leg. Okay, in this case, it should be negative, and lots of times we'll check that for heel pain. Mulder's sign is for neuromas, when we squeeze the foot side while pushing into the second or the third interspaces. We're generally not going to do this with a plantar fasciitis patient, so I'm going to leave that blank. Skin, normal is going to be warm, dry, and supple. Okay. And you can have multiple things also too. Somebody might have some scaliness also too, but in this case, not. So warm, dry, and supple. If there are rashes, you can see that there are different choices for rash. Any of these can be put. Not applying over here, so I'm leaving it blank. Erythema is redness, so present, absent. If it's present, we say where it's located on the long line over here. Ecchymosis is bruising, same thing, absent or present. And we can say in this case it's absent, there's no bruising anywhere. Hard corns are like regular corns that we see on toes or different parts typically. If it's someplace other than these, we can say other and specify, or you can even leave other off of it and just kind of put it on the long one. Same thing with soft corns, which are typically in web spaces. But we'll call that out if there are corns one way or another. We'll say, there are corns noted at the second toe, third toe, fourth toe. There's a soft corn in the fourth web space, and these will just be clicked off. Same thing goes for calluses also to different places. Calluses may be present. Fissures or cracks in the skin. This is typically where they're located. We can specify further. If there's a fissure on the medial right heel, you could say heel, and you could say medial border, something like that. Okay, in case we're not doing that for this, because that's not what this patient is looking for. Same thing with verruca. There are different qualities for verruca. We could say kind of what's noted with it, and locations also too. Again, if anything's not mentioned, we can always mention it here or mention it freehand in here. Other skin lesions would just be moles and other suspicious type lesions, whether they're tender, non-tender, and again, you can click multiples of these, or just kind of describe it on the side of the long sections. Nails, we've got different conditions of nails, and also which nails are involved. Ulcerations, various locations, or we can specify locations, and the stage, in addition to other findings that we would kind of see with that particular ulcer. So now we go to, we would go through the, say dermatologic exam says, the nails are all normal. You can just say normal. If you want to put 1 to 5, you can. But normal would be good enough. If it's abnormal, we could say something different. Okay. Everything else may be normal also too. Musculoskeletal muscle power. Most patients are going to be 5 out of 5 of all groups. They're healthy. Range of motion. Lots of patients with plantar fasciitis will have normal motion except for limited dorsiflexion at the ankle. So I would typically say range of motion on the right is all normal with the exception of limited dorsiflexion. And it would be that one. The first one would be if everything is all normal. Okay. If someone's got a bunion, we might say that they've got tracking on range of motion of the first MPJ, which means when we try to move the first MPJ up, the big toe kind of goes over into a bunion position. Other deformities, and if there's multiple things here, or it can be just specified down the side over here. Pain on palpation, this is a right heel pain patient. So we're going to say tender at the medial calcaneal tubercle, which will be pretty common what's going on over here. And I might even say no tarsal tunnel tenderness, and that can be put over there. And lots of times we'll be trying to rule out tarsal tunnel versus plantar fasciitis, because sometimes they can both have heel pain. I'll also sometimes lots of people with plantar fasciitis may have posterior tibial tendonitis, and so I might have also say, and also there is no posterior tibial tendon tenderness, and that can be put in there also on the side. Okay. Pain on passive range of motion, I'll just say none. Pain on active range of motion, none. Crepitus on range of motion, none. Okay. Arch type, I'll say patient has decreased medial arches bilaterally. Any soft tissue masses, none. If there were, there's information for location and also findings associated with that. Might be used for ganglion cyst, a lipoma, other soft tissue masses or lesions. Other structural notations, these are other little things over here. We can say sometimes if the patient's kind of has a flat foot, we can say, okay, they have a flat foot, they have midfoot planus over here also too. And I'd say, there's planus bilateral. I could say there's metatarsus adductus bilateral. This is typically where it would be. And I could say as far as other structural notations, this, again, you don't have to put anything if we're not saying anything. You can just skip over them. Biomechanical and gait exam. We may or may not do this. This is something that we typically with pediatric patients that are walking abnormally have in-toe, out-toe gait. If they're heel walking, we'll have things that are over here. Some patients may have knee alignment area. We might say there's, with regards to knee alignment, there's genovalgum or genovarum, or the knees are straight. That's something that might come up. Okay, so in this case, we'll just say knees are straight. And we might do a gait analysis. Okay. One of the things that might have, she has right heel pain, can say favoring the right side. Okay. I can even say antalgic, means they're limping, favoring the right side. And that's basically, and then you would save this. And you can see this is how the encounter would show up, like looking, you can always check to make sure everything looks okay. Here's the physical exam. Here's our history of chief complaint. This was, in this patient's example, there was already pre-populated in there some allergies and medical history stuff. But here we can see alert oriented. Here's our pulses, our cardiovascular examination. Here's our neurological examination, dermatological here. Musculoskeletal, again, 5 out of 5, all groups. Limited dorsiflexion, normal plantar flexion, inversion, and eversion of the ankle bilaterally. Whereas the pain on palpation is tender at the medial calcaneal tubercle. There's no tarsal tunnel tenderness. There's no posterior tibial tenderness. Again, none of these pains on range of motion. You can see there's arch type, medial arch, decreased medial arch, decrease on the right, decreased medial arch on the left, midfoot planus, knee alignment is straight right, straight left, gait analysis, antalgic favoring the right side. And that is our objective portion there.